Good morning, everybody. Brian Rice. I'm president of California Professional Firefighters, and joining me today is Chief Dan Stefano and Chief Ralph Terrazas. And we're going to do just a little bit of an introduction to our town hall that we did on COVID-19. And it really is part of a series that both labor and management have been working on. Although many of the things that we do together aren't always, we're together like this, but we keep in touch with each other as we message COVID and try to bring a unified message to our membership. And really the message now is that the town hall was one of the most watched events that we've done. The information there is really important. And, our job collectively is to encourage more and more firefighters to get the vaccine, how incredibly important that is, number one, for you, your family, and then the public you serve. So I'd like to introduce Chief Ralph Terrazas and Chief Dan Stefano. Ralph, if you want to open up and say a few words, and Dan, if you want to finish after.
Well, Brian, thank you for the invitation to amplify the message about the importance of vaccinations. We have been aggressively educating our people. We've been trying to influence them by having myself and our union president, Freddie Escobar, take the shot. And yesterday, actually, I gave Freddie his second shot and he gave me my second shot. We have so far vaccinated about 65% of our firefighters in about 3 weeks. Also, in the last 90 days, we've had 550 firefighters test positive. So it's not recommended that they take the vaccine yet. So if you add that number to our 65%, we're somewhere between 75 to 80% with some level of protection. That is corresponding to a dramatic drop in the number of firefighters testing positive. The last 3 days, we've had 0. So that's significant. Right now, we have about 30 firefighters in isolation. About a month ago, we had about 210. So we are seeing a dramatic drop. Unfortunately and tragically, we've lost 2 of our firefighters, Jose Perez over the summer and George Roque just about 2 weeks ago. Fire chiefs have the unpleasant task of having to go to funerals, talk to families, do everything we can to keep our people safe. And getting a vaccine is one way to do that. Now we have 2 families that no longer have a husband, a father, young children who have a void and a gap. And it is very, very sad and tragic, but we can avoid that. And the way we do that is that we vaccinate, not only for the safety of the individual firefighter, but their family and their coworkers and the communities that we serve. So I strongly encourage all firefighters to get vaccinated.
Thank you, Chief Terrazas. Chief Stefano, Dan, you're up.
Well, thank you, President Rice and Chief Terrazas, for those words. I'll echo the same thoughts. I want to, on behalf of the California Fire Chiefs Association, just say what an honor and how proud we are to partner with CPF on this. As President Rice said, there's a number of issues out there, but on the critical issues, we are lockstep, and we are absolutely in lockstep on this particular issue. As we look at it, I also value the personal choice and individuals' choice to make their own decisions. But those decisions should be based on good, valid, and reliable information. And I will say this town hall is compelling, and it is absolutely clear. I have not seen something as compelling as this that's been presented on the COVID-19 vaccination process. So the experts in our business speak directly to it. Dr. Benson, Dr. Mackey, and Dr. Kazan do an outstanding job of lining it out. So my hat's off to President Rice, Mike Feig, and CPF for putting this together. But anyone who has questions of it after seeing this video, all those questions should be answered. And it goes far beyond, and as Chief Terrazas said, this is about protecting our own, our brothers and sisters who are serving, but it goes beyond that. It's the communities that we serve, it's our families. And quite honestly, the message in this town hall is something that we should share well beyond our firehouses. But it certainly answers the questions that have come up as we sit in the firehouses with our firefighters and have those discussions. It certainly answers those questions and does an outstanding job. So again, my hat's off, and Cal Chiefs is just proud and honored to be part of this solution. And the vaccination process is here, and we now have the questions that are answered. So thank you for that.
Chief Stefano, Chief Terrazas, Dan and Ralph, thank you so much, not only for the labor management partnership, but the relationship and the friendship over the last couple of years and the things that we've been able to work on together. And before we start the town hall, you're really going to listen to Mike Fye, our Health and Safety Director from California Professional Firefighters, then Dr. Clayton Kazan, who is the Los Angeles County Medical Director, Fire Medical Director, Dr. Peter Benson from Contra Costa County Fire, and Dr. Kevin Mackey from Sacramento Fire. And I'm going to close with this, and you've all heard me say this before. Go back to the day when you did your firefighter interview and think about the things that you said you would do to get this job. This is one of those moments. And I know that the vaccine and much of this has been politicized beyond any of us. But this truly is that moment where you raised your right hand and you swore an oath to do everything you could to protect your community. And receiving the vaccine is one of those things. I remember 20 plus years ago when we all, actually it was more than that, it was over 30 years ago, when the AIDS epidemic hit. And I worked in Sacramento, 100 miles from San Francisco, where well over 30,000 men between the ages of 18 and 40 died, and we didn't even know what it was. And if there was a vaccine, we'd have lined up and taken it without a second thought. On the heels of that was hepatitis, and we did the same thing. We all lined up and got our vaccinations. COVID is the same thing. And go back to the day when you accepted this job. The fire department didn't chase you down and ask you to come to work. You chased the fire department down because you knew what an honorable profession this was. And now the fire chiefs, your union, your state union, the international, the Cal Chiefs, the Metro Chiefs, we've all done everything that we can to protect you, the members. And the last thing that can be done is up to you, and that is getting the vaccination. So with that, Dan and Ralph, thank you so much. And I'm going to turn this over to the town hall. If you have any questions, contact your department EMS officer. You can also contact the CPF Health and Safety Director, Mike Fye. And with that, I wish everyone a good day and a prosperous 2021. Thank you.
There's been a lot of information regarding the COVID vaccine out there, and sometimes it's making it pretty difficult to tell fact from fiction and what's going on. Can you tell us a little bit about the science behind the vaccine and some of the mRNA technology that's being used?
Yeah, I think the first thing that's important to say is that a lot of folks, myself included initially, believed that, boy, how could you make something so quickly and do it with any quality and make sure you got it right. And really this technology replaced a lot of the previous older technology, which just took a long time, whether you were culturing it in an egg or just working on developing an antigen. It took months and years at times. What the mRNA did was allowed us to create the ability to develop an antigen much faster. And that mRNA basically went from, instead of sending the antigen into the body as a vaccine and get the antigen in and have the immune system respond to that like a typical, say, flu vaccine, what the mRNA does is it kind of builds that antigen on site. So it gets into the cell, it releases some mRNA, which goes out and generates this antigen, which then gets to the immune system. So it's very simple, even though it's an mRNA vaccine and people get concerned about it, they worry about the genetic issues. It's a very simple vaccine, and perhaps the most reassuring part about it is that RNA is dissolved within 24 hours. So a lot of folks think it's going to get into the system and circulate in the body and cause problems and side effects downstream. But this RNA is simply, it will create the antigen, allow the immune system to now be responsive to a COVID infection if it occurs down the road, and that RNA is all gone, and it's basically a very simple process, despite the sort of science fiction sound of an mRNA vaccine. I know Dr. Mackey has some other ideas on it. He can probably fill in some of the other details as well. He's real up on the science of it.
Is it okay if I just do a quick screen share?
Absolutely.
Okay. So let me start the presentation here, and so that it looks right on everybody's screen. So everyone knows that the two leading developers out there so far are Pfizer and Moderna. And I want to point out, like Dr. Benson had said, these are called third generation vaccines. And as he alluded to, influenza is grown in like egg cultures, the influenza vaccine, and it takes months to be able to grow enough vaccine in enough numbers. And for this vaccine, we're talking about having to produce billions of doses. In the history of our world, we've never had to produce 1 billion doses of any one vaccine. And this is has to be a very fast and efficient process. So these are called third generation vaccines. And at the bottom line here is what we need to do is to educate our immune system. If you have a pneumonia or urinary tract infection, we can treat that with antibiotics. However, you can't treat a pandemic that's caused by a virus with antibiotics. They just don't exist. So you need a vaccine, because the vaccine needs to teach our immune system how to build immunity. So these are how the vaccines actually work. I'm just a big Matrix fan. And so I want to walk you through actually how they develop this. So this is the coronavirus, and what we're interested in is a spike protein. And what the researchers were able to do is to sequence the genome of coronavirus very early on, and they looked for that small red squiggly part, which is what encoded that spike protein, and they pulled it out and they isolated it. And after they isolated it in a lab, they can make millions of copies of it, and then they can package it in a vehicle that can then be administered through a vaccine that can readily cross our cells and enter our cells and begin to teach our immune system how it works. And this is basically how it works. These two small rocks you kind of see sitting on top of each other called ribosomes. You can think of those as like the copy machine of our cell. They take mRNA and they recognize what the code is, and out of the code they make the protein that's being told to make. So the vaccine instills the mRNA from the spike protein into our cell, and we start to produce just spike proteins. That is really key in take home, because there is no live virus in any part of this vaccine. There's only the mRNA that produces the spike protein. So when those spike proteins get released, they have to go into our immune system, and this is where the education starts. They get absorbed by some cells, and those cells then digest this protein and they present them on the surface, and they start to sound an alarm that says that there's a foreign body present. And that foreign body gets presented to this helper T cell, which you can consider the educator of our immune system, teaches our immune system what to look for. And the helper T cell comes alongside these macrophages or antigen presenting cells and says, oh, hey dude, you don't belong here. I'm gonna go looking for you. And so it memorizes what this looks like, and then it goes and teaches the army of our immune system, which are the B cells, what to look for. And then the B cells go, okay, now I know what to go look for. And they start producing antibodies, and the antibodies are what go out, track down, disable, and kill the virus. So in a bottom line is, these vaccines are an efficient way for our immune system to basically go to school and learn what this thing looks like, and then go out and kill it. And I'm going to stop there, because I know there's going to be questions later about herd immunity, and I've got a good graphic right after this for herd immunity, but I'll stop there and I'll come back in when we're ready for that.
I'm just going to hit a couple of quick points on top of Kevin's. By the way, I wish Kevin taught my immunology class in med school. But no, the couple of quick points are messenger RNA that is for just a small piece of that spike protein. It does not enter the cell nucleus. It does not touch your cellular DNA. It does not change your cellular DNA. Your cells make messenger RNA constantly throughout your body. The molecules are relatively unstable, and so they disappear in about 24 hours. Your body metabolizes them back into their pieces and then recycles them and uses them later. So, but those are some key questions that come up about this vaccine. The science is actually really simple, like Kevin described. Pulling it off is difficult. That's why it took a long time to bring one all the way to development. But this is not new in that they have been working on doing just this for more than 25 years.
One other thing that was somewhat reassuring for me as well was the fact that these mRNA type vaccines, this is not the first one we've seen. There was some rabies vaccines comprising several hundred people, which was 3 or 4 years ago. And those people have, you know, if you're concerned about things like long-term effects, we now have some years of experience behind us of other mRNA uses, whether it's in a cancer vaccine or in a rabies vaccine, and there was even a flu vaccine that was tested with that. And the fact that we can now look at the outcomes of those folks several years later, and see that no surprising side effects have developed is very reassuring.
We know that there are firefighters out there that are very hesitant to getting the vaccine for a myriad of reasons, which I will be respectful of all of them. And if you could just give a message to the firefighters that you serve as our medical directors and watching over and out for us about this vaccine, what would it be? And I'll start with Dr. Mackey, then Kazan, and Dr. Benson, I'll let you close up. Because that's kind of the whole goal of this is if we can see and ease the minds of some of our firefighters, what would you tell them? You have direct access to a lot of people right now.
I am in the same camp with you. This is a personal choice, and I respect their personal choice, but this is much bigger than a personal choice. So we are all in the business of public service. And although this vaccine will protect you and ultimately protect your brothers and sisters in the fire service from when it gets into a firehouse or you go on a call and you're exposed to it, it also protects our community as well. And as I alluded to, the only way to get out in front of a pandemic is to build enough immunity in the community. That's it. There is no other way. In current technology, there's no other way. And this is the only way, is to build immunity. And I've had several firefighters ask me the question, well, I've had COVID-19, don't I have immunity? And you know, the answer to that is yes. We don't know how long. Some of the numbers that you'll hear talked about is at least 90 days, there's an immune protection. But the question then becomes, is the vigor or the strength of the immune response comparing someone who's had COVID-19 versus someone who's had the vaccine, and then how long the memory of that response lasts. And what we know is that the people who get the vaccine compared to those who've just been infected with COVID-19 have a much more vigorous, much stronger, much more effective, much more efficient response to COVID-19 when and if they encounter it. And the memory appears, if it's consistent with prior vaccine technology, the memory of that response is going to be considerably longer than if you've just had the disease once. So that would be what I would tell the members.
Dr. Kazan?
Thank you. I would echo what Kevin said, that it is a personal decision about whether people want to receive a vaccine or not. And as much as I am a very strong advocate of vaccines, I also recognize that this is a vaccine that does not yet have full FDA approval, and it is relatively new out there. The reason I trust the science is because vaccines themselves are not new. The first vaccine was in 1797. The first time, by the way, that the US government, well, sort of, or a fraction of the US government mandated an inoculation was during the Revolutionary War in Washington's army against smallpox. So this is not new. The vaccines are the reason why we have a life expectancy of 80 years. Yes, it's cancer treatment and diabetes treatment and heart disease treatment and stuff. Very true. But the reason why we tend to live a long time is we don't die of all the childhood diseases that we used to die from. Most of you, I'm sure, have never seen a case of active polio, measles, things like that, because we just hardly ever see them anymore. What I would say is, for most people, they describe and they'll say, you know, I'm really not afraid of this because 99.8% of people survive this anyway, so why do I need a vaccine? Well, 99.8% is not the correct number. So far, the mortality is somewhere, you know, about 2%. We think it's going to settle in overall, probably in the 0.5 to 1.5% range. And yes, it's more in the older population and the chronically infirmed and less in the younger populations. But remember, even at 0.2%, there are about 100 million people in that 20 to 40 age range, and 0.2% is 200,000 people that will die. And that's more than any Civil War battle. I mean, just imagine if you could do something to reduce that number by 95%. Wouldn't you want to do that? So I trust vaccines in general. I trust the science that's behind them. And the last thing I will say is, while it may not affect you, what we see is that it affects the people that you inadvertently infect. We have seen as many as 15 of our members get infected from a single person. And then those people go off and infect other people and infect other people. And some of those people will not fare well. Many of the people that come to my emergency department that are never going to leave have no idea how they came into contact with the virus. They were being so careful, and yet they have it, and it's now too late. So remember, it's not just a personal choice for you. For this to work for us, and I think Kevin's going to talk about herd immunity in a little bit, but herd immunity has never occurred without a vaccine. If we're going to get there as a community, we have to take some community responsibility, and we have to jump in and do this to protect those around us. So our family members, our friends, our other members of our community, our patients, because we're also all healthcare workers. We have a duty and an obligation to protect our patients from any disease that we can inadvertently spread to them. So that's why I believe so strongly. But I do respect personal choice. I just want to make sure that people are basing their decisions on good information, not just what's being streamed out so widely in social media. Thanks, Brian.
And Dr. Benson, I'm going to have you close up, and Mike will go directly to you.
Yeah, I'll just add, I agree with everything that was stated. Frankly, one dead firefighter or dead firefighter's family or kid or grandparent or coworker is one too many. And we've already seen one too many. And it's time to stop this. The vaccines are way out of this.
Well, good. Thank you. Next question to each of you. And I'm going to go to Dr. Kazan this time. You can start it out for us. But I mean, you kind of talked about where we are right now, but what do the next few months look like for the state in terms of COVID spread? And again, we've talked a little bit about it already, but how important is the vaccination to ending this pandemic?
The best way that we can reduce the spread around the community is the number of people that are susceptible to it, because it has to spread from human to human. It doesn't live on surfaces very long. The predominant way it spreads is proximity and time. So if we can, the people that are coming into contact with infected people, if they themselves are not susceptible to it, then the virus will die in that individual when they recover and doesn't spread. We consider that the R value, which is the number of people each infected person infects. Once we can get that R value below 1, every person that gets infected infects less than one other person, and then we begin to see that decline. And so the quickest way to get there is a vaccine. If we allow it to go through our community and just rip through society like it is in California, and in particular Los Angeles right now, the problem with that is, number one, you're going to get a lot of unnecessary death that's going to occur. Not just because people got infected who didn't need to get infected, but also because the healthcare system is overly taxed right now and people can't get the level of care that they need to get. That's number one. But number two, the immunity does not appear to last. We've seen many of our own department, well over a dozen, get reinfected. So you can't, the people that become immune, the immunity disappears, and then they just jump right back in the bucket of susceptible people again. And it's just going to keep going through in waves until we can get enough people immune. And then can I pass to Kevin for herd immunity?
That's perfect.
Yeah, this will just take a second. Everyone can see that, I imagine. So let's imagine in the middle of this, there's one person, that's the red dot that comes down with the virus. And then if we know as that person has contact with people around them, this will slowly spread and spread and spread as we've seen through our community. But let's take that same person again, and let's say that we have several members of our society that have gotten the vaccine, represented here by the blue circles. Is that person would potentially infect those people around them, which that person most certainly will. More people around them start to get the vaccine, and it becomes more difficult for that virus to begin to spread through the community. But let's say like maybe another person over in another segment of our community comes down with the virus, but they're already surrounded by people who've had the vaccine, and the spread essentially comes to a grinding halt. So this is what the picture of herd immunity looks like. You're caging off the virus with enough people in the community that eventually have got immunity so it cannot spread. So that's just a very quick graphic about herd immunity.